Hi, I'm Jasper Daube. I was president a long time ago. Let's see what the paper says. 83 to 84. And before that, 6 years as Secretary-Treasurer, a few years on the board. I don't know what it's like to be on the board now, but among my fondest memories were, as some of the other board members from back then will remember, were the fights that we had. We had some good knockdown, drag-out discussions about how to do this and how to do that. I suspect Austin Sumner didn't think they were something to be fond of, but I think he and I developed a remarkably good relationship in our disputes. Now I've got a series of questions here, and I can't remember them, so I'm going to look them up. What issues were facing you while you were president, both within the association and the external environment? Not much different than they are now. Financial stability, making sure there were enough members coming and increasing the number of members, making sure that the finances were positive, that the cash flow was appropriate, we had enough money on reserve at the bank. I worked closely with Ella Van Langenham, and I'm proud to have been the person who hired her and moved the office to Rochester. And I worked very closely with her. She was a very rigorous financial wizard, and she and I probably had the greatest effect in my judgment on bringing true financial stability to the organization, and it's done very well since then. Prior to that, it was kind of, well, yeah, let's do this, without really looking carefully at what the cost would be, and what were we investing in, and what would the returns be. Working with Ella was a delight in itself, as it was with the other staff, some of whom are still around, and I guess I won't name names because they don't want you to know how long ago they came on board. Okay, fondest memory. I think I've touched on that. Issues facing, touched on that. What changes did you bring to the AAEF? I guess I touched on that. It's focusing on having a rigorous approach to finances, both as Secretary-Treasurer and in President. And what was it like to practice medicine, or electrodiagnostic medicine, back when I was president? Well, the issues were much the same. It was being able to teach the residents and the fellows how to do superb EMG, how to do it based on looking at the patient's problem, developing a hypothesis based on the clinical history and clinical examination, and building the electrodiagnostic studies around that, that is tying clinical together with EMG. There has been and continues to be an approach that this is a test as opposed to a consultation, and urging the members to recognize the importance of being a clinician and doing electrodiagnostic testing, being a neuromuscular disease expert, if you will. I think the directions the organization has taken over the last few years have continued to move us in that direction. I think it's the right direction, but it's something we started many years ago, both primarily through our educational activities. I'm not sure that's an accomplishment, but it's something that I'm proud of. Specific practice of medicine, practice of EMG. The differences probably were primarily with the computers. Most of the equipment that we had back then at Mayo, or a lot of it was built in-house. We still had some of the old pieces of equipment that Ed Lambert had put together. They've been phased out and replaced by some of the modern computer-based digital equipment. Being able to work with that makes it much easier. You actually don't have to think very much about filter settings or sweep speeds. It's all automated, and that in a way is a problem, because if something is misset, you're less likely to recognize it. That was the biggest difference, is the computer equipment, the computerization of what we were doing. The specifics of stimulating, recording electrodes, needle electrodes have not changed very much. They've gotten a little sharper perhaps and a little more reliable, but the biggest difference was in the equipment. The patients and their problems were the same. And I think that's what we need to remember, even as we move into developing new techniques, that the issue still has to be built around what are the patient's needs and how can we best help the patients. I had fun doing it. I'm still having fun. Plan to do it forever.